For those who are new, who are we? Envita Medical Centers. I'm Dr. Prado. I was the founder of Envita. About 25 years now, I say 24, but unofficially 25. We've worked outside of the insurance model to help people who failed cancer treatment. We're 5 minutes from Mayo Clinic down the road here in North Scottsdale. We're 15 minutes from MD Anderson. We were 30 minutes from what we used to be Cancer Centers of America, which is owned by City of Hope. All these cancer centers, where did these patients go when they failed care? Many of them came to us. And they lived longer. They had a better quality of life. So in 2020, we ran actuarial data. We took top national actuaries, got our data back. After a year, all that work, we were half the cost for what at the time we thought was 350 to 400% better outcomes through the actuarial data. The paper we're publishing in April, you will see it's 3,500% better outcomes. We actually, because of the data metrics, I'll show you that. And you go, what in the world? You mean Mayo Clinic? You mean Sloan Kettering? You mean Dana-Farber? Yes, that's archaic medicine 2.0. So what you got to pay attention to, what Envita does, it gives you the best of 2.0. So you can still go to all the doctors and everything you want and go to the best, but we'll navigate you to high quality score facilities, not the guys with the best resumes, but the doctors that have the best outcomes. That's a high quality score facility, significantly different. What you want are the doctors that have the less readmittance to the hospitals, better outcomes, and the high quality scores, we navigate you there, okay? So 2.0, you lose none of that. Go to any doctor you want. 3.0 is what every healthcare is missing until you bring on Envita's Biomed and Envita's healthcare plan, because now you have access to biometric data sets, which is the future of medicine. It's called personalized medicine. So why is Biomed so important? 1% of your claims are driving 40% of your costs. Do you have any program, everybody say no, that does this? Nobody. Envita's program is designed to go after the sick and those in need of help. The ones nobody wants, the cancer, the autoimmune, the difficult disease, the neurodegenerative. We love that population. That's what we've been specializing in for 20-something plus years. We take care of them with Medicine 3.0. How does this really work? I always go back to this image. There are three populations in every employer group and even in your own household. Chronic disease, they're very sick, cancer, autoimmune, very expensive, very difficult, usually not getting well. Unhealthy, overweight, obese, have higher risks. And the quote, people who think they're healthy. Because as soon as we run the lab data sets on them with AI, they aren't so healthy. But these three groups make up every population. So in real time, Biomed AI, through our data, through our proprietary, we're going to be patenting it, software, we immediately take that in. From the moment we do the continuation of care, when we're onboarding, every employee fills out a COE form, a continuation of education, a continuation of care COC form, and we are gathering that data. We're working on everybody. The focus for us on our algorithms is always the sickest and most important populations, but we take care of everybody. The reason is they're going to impact the cost the greatest. How do you decrease cost? Everybody say there's only two ways to decrease cost. Decrease quantity and severity of the claims. You have nothing right now in your plan, I promise you, that does that. Nothing. Biomed does. Because we're actually looking at the individual person like a fingerprint, and we have all the data sets to help them get well. Advanced genomics, transcriptomics, immunotherapy, algorithms that are personalized medicine, custom regimens for the. So if a patient's on the wrong drug, what are you going to do? They're on it. Nobody knows they're on it. Cardiologist doesn't check for that. Nobody. We test. We do a pharmacogenomics. They can't metabolize it. We immediately, our pharmacists immediately move them. Our doctors get on, and we say, "Here's a medicine for you." It's all done instantly by phone. Move to this drug, or we'll custom make it for you. That's a game changer. Think of a drug that's shutting down your kidneys and is going to reduce your lifespan by 7 to 10 years. And let's say 25 to 35% of people on medications are having a hard time metabolizing these kinds of drugs. We fix it immediately. Our algorithms know what those drugs are, know what those high-risk populations are. We screen them. We put them into the right communities. That's Biomed. It's happening for you, right? If you have major medical with you, it'll cover the whole process, right? Because it does even more. The Biomed begins the screening. It does a lot of the preventative care. It does the navigation. It'll do the telehealth. It'll do a lot of it. But then if we've got to send you to our centers of excellence, obviously it's not covering full oncology care, right? That goes through your claims. So as long as we're in the plan design, boom, the claim is covered. Enhanced outcomes, improved quality of life, decreased severity and the quantity of total claims. Here's a group. You'll see we do this. You'll see the exact drug breakdowns. You'll see the exact condition breakdowns. You'll see all the intercepts. And then if you go further down, we give details and the physician is right there. The biomed costs nothing to the employer. They just get tax incentive. So there's no reason, if you understand biomed, why every employee across the United States shouldn't have it. And all they have to do is opt out. So you'd have them opt in, and then they would opt out because they're getting more money in their payroll. They're getting access to technology they never had before. They're getting preventative care. I'll go into all this a lot. If there were 125 plans that used to be out there and they kind of stinky and some of them don't really pass the smell test, they're all right. There's some have been out there. But when you attach Envita, look at the difference. To the left and the right combined, not just standard services, but look at all the second oncology, anti-aging medicine, pharmacogenomics, screening disease. You've got centers of excellence. It goes on and on and on. And then, yes, you also get discounts on generic drugs. You get dermatology. You get all the virtual care. It's in real time. You get dental. The reason we separated this is because people don't really understand this space well, right? The old adage was these 125s, well, they may be gray area. They're not gray area. We have an entire legal team, and not only that, full-time general counsel, expert in the space, that get on the phone with your legal team and their accountants, and it's a no-brainer. The problem is they're not run right. Our design, our documents on this, when we call about our plan design, is about 60 pages long. And our EOB and claims are so tight, we welcome an audit. We welcome it because it's all tech. But you can see how in-depth our program build is compared to anything else that's out there. And it's the way you set this in is you just make it opt out. So no matter how big the company is, they put it in, and the employee opts out if they don't want to make more on their payroll, if they don't want access to discounts and so forth. They usually do. So what you're doing is you're using Biomed at a tax savings to actually run a personalized medicine program that's at the level of concierge, anti-aging, bioidentical, chronic disease treatment. So it's very powerful. It'll bring the cost down for your entire program with a strong focus on outcomes and quality of life.